bringing more attention to Alzheimer's and all forms of dementia across Arkansas. That's what the Arkansas Alzheimer's Association is trying to get state lawmakers to do this session. 5 News anchor Darren Bobb spent the day at the state capitol to find out what one new piece of legislation would do.
There's nothing more disturbing to a human than when your mother looks you in the eyes and says, "Who are you?"
Ricky Hill's mother has Alzheimer's. He was one of a number of caregivers, healthcare workers, and those whose families are affected by dementia that gathered at the Capitol during Alzheimer's Awareness Day to learn more about one piece of legislation that deals with public awareness. David Cook with the State Alzheimer's Association says the new legislation would allow the state health department to put more emphasis on dementia awareness, much like it does with other diseases.
We know the health department and the Department of Human Services have done a really good job in the past in managing other diseases and doing public awareness campaigns around issues like diabetes, stroke, and hypertension. And we'd like to take that same expertise and apply it to the Alzheimer's and dementia space.
State Rep Zach Gramlich of Fort Smith says he knows all too well the effects of a lack of awareness.
My grandmother, she had, we were camping with her and she wandered over to someone else's truck and tried to get inside, and dude came out of the camper and punched her in the face. About broke her bone right here. I mean, like people don't understand, and they have no context that these people are lost and they need help.
The majority of our lawmakers feel this issue personally. Either they've been personally impacted by losing a parent or a grandparent to the disease, or being a caregiver themselves. At the least, they know someone who has. So we've seen really good response over the last few years here at the state capitol.
State Senator Justin Boyd of Fort Smith says this bill won't cost the state a dime more to implement.
Revenue neutral is helpful, appropriate, and it's common sense. I mean, the revenue is already going to the health department. It's just making sure it's allocated accordingly. The health department is already working to get these resources out in the community. We just want some of the emphasis to move on to Alzheimer's and dementia.
And it's that no-cost part of the bill that Gramlich says makes it a no-brainer.
We don't really talk about it, it's not really front of mind, and I know there's a lot of organizations that try to make it, but we need to have that kind of advocacy just like we do for anything else.
In Little Rock, covering news where you live, I'm Darren Bobb, 5 News.
Some powerful stories there. Well, other possible legislation this session could include a bill asking for more money for a program that allows caregivers more respite time at no cost to them.